Your liver is failing and your body has been screaming about it for months, but you've been ignoring the signs because they seem unrelated. That yellowish tint in your eyes, the itchy palms that won't stop, the weird spider-looking veins on your chest. Your liver is sending distress signals through your skin, your eyes, even your fingernails. And if you know what to look for, you can catch liver disease before it becomes irreversible. Let's go through the 12 signs your body shows when your liver is in trouble. Before we dive into the signs, let's get one thing straight. Your liver is not some optional organ you can live without. It's a 3-pound chemical factory sitting in your upper right abdomen doing over 500 different jobs. It filters toxins, produces proteins, stores energy, makes bile for digestion, and regulates most of the chemical levels in your blood. When your liver starts failing, your entire body falls apart. But here's the good news. The liver is remarkably forgiving. Catch the disease early, and in many cases, you can actually reverse the damage. The problem is most people don't recognize the early warning signs. They think liver disease means jaundice and cirrhosis, the end-stage stuff. But your body starts showing subtle signs way before that. Some of these signs seem completely unrelated to your liver. You might think you have a skin condition or allergies or just bad luck. Meanwhile, your liver is deteriorating. Let's start with the most obvious sign, the one everyone's heard of: jaundice. That's the yellowing of your skin and the whites of your eyes. But here's what most people get wrong about jaundice. It's not an early sign. By the time you're visibly yellow, your liver is already in serious trouble. Here's why it happens. Your liver processes a substance called bilirubin. This comes from the breakdown of old red blood cells. Normally, your liver grabs the bilirubin, processes it, and dumps it into your intestines as part of bile. But when your liver is damaged, it can't process bilirubin efficiently. The bilirubin builds up in your blood, and because it's a yellow pigment, it stains everything. Your skin, your eyes, even your urine turns dark brown or orange. The yellowing usually starts in the eyes first. The whites of your eyes, the sclera, they turn slightly yellow. Most people notice this before they notice their skin changing. If you pull down your lower eyelid and look at the inside, that's one of the first places you'll see the yellow tint. Then it spreads to your face, your chest, and eventually your whole body. But let's move on to the earlier signs, the ones that show up before jaundice. Sign number 2 is something called palmar erythema. That's medical speak for red palms. Your palms, especially the outer edges and the base of your thumb, turn bright red, not a little pink. Bright red like you've been slapping things all day. This happens because of changes in your hormone levels. A damaged liver can't break down estrogen properly, so estrogen builds up in your blood. This causes the small blood vessels in your palms to dilate. More blood flow equals red palms. Men with liver disease often develop this along with other signs of elevated estrogen, which we'll get to in a minute. The red palms are usually painless. They might feel slightly warm. If you press on the red area, it blanches, meaning it turns white briefly, then fills back in with color. This helps distinguish it from other causes of red hands. But here's the thing. Not everyone with liver disease gets red palms, and not everyone with red palms has liver disease. Pregnant women get it too because of their elevated estrogen. But combined with other signs, it's significant. Sign number 3 is spider angiomas, also called spider nevi. These are small red spots on your skin with tiny blood vessels radiating out from the center, like spider legs. They're usually found on your face, neck, chest, and arms. You press on the center and all the little legs disappear, release the pressure, and they fill back in. These form because of the same hormone imbalance that causes red palms. Excess estrogen causes small arteries in your skin to dilate abnormally. Most people have maybe 1 or 2 spider angiomas and they mean nothing. But if you suddenly develop multiple spider angiomas, especially on your upper body, that's a red flag for liver disease. I've had patients come in worried about what they thought were bug bites or a rash, and they had dozens of these things scattered across their chest and shoulders. Combined with other liver signs, it's basically diagnostic. Your body is covered in tiny markers of liver dysfunction. Now let's talk about sign number 4, one that bothers people more than almost any other symptom. Itching. Intense, unrelenting itching, especially on your palms and the soles of your feet. This is called pruritus, and it's one of the most miserable symptoms of liver disease. The itching happens because bile acids build up in your blood when your liver can't process them properly. These bile acids deposit in your skin and trigger nerve endings. The itching is worse at night. It's worse in warm environments. Scratching doesn't help. In fact, scratching makes it worse because you damage your skin and that triggers more itching. People with severe liver disease describe the itching as torture. They scratch until they bleed. They can't sleep. They try every lotion, every antihistamine. Nothing works. That's because the problem isn't in your skin, it's in your blood. The only real solution is to treat the underlying liver disease or use medications that bind bile acids in your intestines so they can't recirculate. If you have itching that won't respond to normal treatments, especially if it's concentrated on your palms and feet, get your liver checked. This is one of those signs that seems completely unrelated to liver disease, but is actually quite specific. Sign number 5 brings us to your fingernails. Believe it or not, your nails can show signs of liver disease. There's a specific finding called Terry's nails. The nail bed looks white or pale except for a narrow pink or red band at the tip. The whole nail takes on this opaque, whitish appearance. This happens because of changes in blood flow and possibly changes in the nail bed itself due to liver disease. It's more common in cirrhosis, so it's not an early sign, but it's visible and distinctive. If you notice your nails suddenly looking pale and white while the tips stay pink, that's worth investigating. Another nail change is clubbing. The fingertips become enlarged and the nails curve around them. This can happen in liver disease, but also in lung disease and heart disease, so it's not specific to the liver. But combined with other signs, it adds to the picture. Let's move to sign number 6, and this one affects men specifically. Gynecomastia. That's breast enlargement in men. Same mechanism as the red palms and spider angiomas. Elevated estrogen from a failing liver causes breast tissue to grow. This isn't a little swelling. I'm talking about actual breast development, sometimes significant enough that men become self-conscious about it. The breast tissue that develops is real glandular tissue, not just fat. It can be tender or painful, especially in the early stages. Men with alcoholic liver disease commonly develop this. The alcohol damages the liver. The liver can't process estrogen. Estrogen accumulates. Breasts grow. It's a direct cause and effect. This is often one of the first signs that drives men to see a doctor. They notice their chest is changing and they want to know why. Blood tests reveal the liver problem, but here's the frustrating part. Even if you treat the liver disease, the breast tissue doesn't always go away. Sometimes it requires surgery to remove. Sign number 7 takes us to your abdomen. Ascites. That's fluid accumulation in your abdominal cavity. Your belly swells up, but it's not fat and it's not bloating. It's liters of fluid that have leaked out of your blood vessels and accumulated in the space around your organs. This happens in advanced liver disease. Your liver produces a protein called albumin. Albumin keeps fluid in your blood vessels. When your liver fails, albumin levels drop and fluid leaks out into your abdomen. Also, high pressure in the blood vessels around your liver, something called portal hypertension, forces fluid out into the abdominal cavity. People with ascites look pregnant. Their belly is tight, distended, uncomfortable. They can accumulate 5, 10, even 15 liters of fluid. That's a significant amount of weight. They have trouble breathing because the fluid pushes up on their diaphragm. They feel full all the time because there's no room for their stomach to expand. We treat ascites by restricting salt, giving diuretics to make you pee out the excess fluid, and sometimes doing a procedure called paracentesis, where we stick a needle into your abdomen and drain the fluid directly. But it comes back unless you treat the liver disease. Ascites is a sign that liver disease has progressed significantly. Sign number 8 is easy to miss unless you're looking for it. Loss of body hair. Men with liver disease lose hair on their chest, abdomen, and limbs. Women might notice thinning hair on their heads. This happens because of hormonal changes and malnutrition. Your liver isn't processing nutrients properly, your hormones are imbalanced, and your hair follicles suffer. Hair loss is gradual. You don't wake up one day and find all your chest hair on your pillow. It happens over months. You might not even notice until someone points it out, or you look at old photos and realize you used to have more hair. Combined with other signs, it's part of the pattern. Now let's talk about sign number 9, and this one can be alarming: vomiting blood or having black tarry stools. This happens when liver disease causes varices, which are enlarged veins in your esophagus or stomach. These varices develop because of portal hypertension. Blood can't flow through your damaged liver normally, so it backs up and finds alternate routes, including through veins in your digestive tract. These veins aren't designed to handle high pressure. They dilate, they become fragile, and eventually they can rupture. When that happens, you vomit bright red blood or coffee ground appearing material, or the blood passes through your intestines and comes out as black tarry, foul-smelling stool. This is a medical emergency. Bleeding varices can be life-threatening. If you have known liver disease, we do endoscopies to look for varices and sometimes treat them before they bleed. We can ban them or inject them with medications to make them less likely to rupture. But if they do bleed, you need to get to a hospital immediately. Sign number 10 brings us to your mental state: hepatic encephalopathy. That's a decline in brain function due to liver failure. Your liver normally filters toxins from your blood, including ammonia. When your liver fails, ammonia builds up and affects your brain. The symptoms range from mild confusion to coma. Early on, people have trouble concentrating. They're forgetful. Their personality changes. They might seem depressed or irritable. As it progresses, they become disoriented. They don't know what day it is. They can't hold a conversation. Their handwriting gets shaky and illegible. In severe cases, people become unresponsive. This is a medical emergency because it means the liver is barely functioning. We treat it with medications that reduce ammonia levels, like lactulose, which causes diarrhea, to flush ammonia out of your intestines, and rifaximin, an antibiotic that kills ammonia-producing bacteria in your gut. Hepatic encephalopathy can come and go. Someone might be fine one day and confused the next. It's often triggered by infections, dehydration, constipation, or eating too much protein. Family members notice the changes before the patient does. If someone with liver disease starts acting confused or different, it needs to be evaluated immediately. Sign number 11 is something called Dupuytren's contracture. This is a thickening and tightening of tissue in your palm that causes your fingers to curl inward. It usually affects the ring finger and pinky finger. You can't straighten them fully. The palm feels thick and knotted. This is more common in people with alcoholic liver disease, but it can happen in other forms of liver disease too. The exact mechanism isn't fully understood, but it's associated with chronic inflammation and metabolic changes. It's not reversible with medical treatment. If it's severe and affecting hand function, surgery can sometimes help, but it's not a cure. Dupuytren's contracture develops slowly over years. You might notice a small lump in your palm first, then gradually the fingers start to bend. It's usually painless. The main problem is loss of hand function. Combined with other signs of liver disease, it's another piece of the puzzle. Finally, sign number 12: easy bruising and bleeding. Your liver produces clotting factors, proteins that help your blood clot. When your liver fails, it can't make enough clotting factors. Your blood doesn't clot properly. You bruise from minor bumps. Your gums bleed when you brush your teeth. You get nosebleeds that won't stop. Women with liver disease might have abnormally heavy menstrual periods. Any cut or scrape takes longer to stop bleeding. This is dangerous because it means any injury, even a minor one, can lead to significant blood loss. And internally, it increases the risk of serious bleeding, like from varices, which we already talked about. We can check clotting function with blood tests. Something called the INR measures how long it takes your blood to clot. A normal INR is around 1. In liver disease, the INR goes up, meaning your blood takes longer to clot. An INR over 1.5 is abnormal. Over 2 is concerning. Over 3 means you're at high risk for serious bleeding. We can temporarily improve clotting by giving vitamin K, fresh frozen plasma, or clotting factor concentrates. But these are temporary fixes. The real solution is treating the liver disease or, in end-stage cases, a liver transplant. Now let's put all of this together. If you have one of these signs, it might mean nothing. Red palms alone don't equal liver disease. A few spider angiomas don't equal liver disease. But when you start seeing multiple signs together, that's when you need to take action. Here's a typical pattern. Someone has been drinking heavily for years. They develop red palms and spider angiomas. Then they notice their belly is getting bigger, but they're not gaining weight anywhere else. They're itchy all the time. Their eyes look a little yellow. That's a constellation of signs pointing directly to liver disease, probably alcoholic cirrhosis. Or someone has been overweight for years with diabetes. They have fatty liver disease that's been brewing silently. They start bruising easily. They're always tired. They notice some spider angiomas appearing. They go to the doctor for a routine physical, and blood tests show elevated liver enzymes. That's non-alcoholic fatty liver disease progressing to cirrhosis. The key is not to ignore these signs. So many people see these symptoms and explain them away. The itching is dry skin. The red palms are from washing dishes. The yellow eyes are from not sleeping enough. They rationalize until the symptoms can't be ignored anymore, and by then, the liver disease is advanced. Liver disease is often silent in the early stages. You can have significant liver damage with no symptoms at all. That's why screening is important if you have risk factors. What are the risk factors? Heavy alcohol use, obesity, diabetes, hepatitis B or C infection, family history of liver disease, certain medications, autoimmune diseases. If you have any of these, you should be getting liver function tests regularly. The blood tests are simple. AST and ALT are enzymes that leak out of damaged liver cells. Elevated levels mean liver damage. Bilirubin measures how well your liver is processing waste. Albumin measures liver synthetic function. INR measures clotting. A complete metabolic panel hits most of these markers. It's routine, it's cheap, and it can catch liver disease before you have symptoms. If the blood tests are abnormal, we move to imaging. Ultrasound can show fatty liver, cirrhosis, tumors. CT or MRI give more detail. Sometimes we need a liver biopsy to determine the exact type and severity of liver disease. A biopsy involves sticking a needle through your skin into your liver and taking a tiny sample of tissue. It sounds scary, but it's quick and usually done as an outpatient procedure. The good news about liver disease is that in many cases, it's treatable or even reversible. If you have fatty liver disease and you lose weight, exercise, and control your diabetes, your liver can heal. The fat goes away, the inflammation resolves. You can literally reverse the disease. If you have alcoholic liver disease and you stop drinking, your liver can recover, at least partially. Even with significant damage, abstaining from alcohol allows your liver to regenerate to some degree. The liver is one of the only organs that can regenerate like this. If you stop the damage, it repairs itself. If you have hepatitis C, there are now medications that can cure it. Not manage it, cure it. You take pills for a few months and the virus is gone. Your liver stops being damaged and starts healing. It's remarkable how far treatment has come. If you have autoimmune hepatitis, we treat it with immunosuppressive medications. The inflammation stops, the liver damage halts, and many people live normal lives with treatment. Even in advanced cirrhosis, if you stop the underlying cause, you can stabilize. You might not reverse the cirrhosis completely, but you can prevent it from getting worse. And for end-stage liver disease, there's transplant. A new liver gives people a second chance at life. But none of this happens if you don't recognize the signs and seek help. That's why I wanted to go through these 12 signs in detail. Your body is constantly communicating with you. It's telling you when something is wrong. The question is whether you're listening. So let's review quickly. Jaundice, yellow skin and eyes. Palmar erythema, red palms. Spider angiomas, little spiderweb blood vessels on your skin. Intense itching, especially palms and feet. Terry's nails, white nail beds with pink tips. Gynecomastia in men, breast tissue development. Ascites, fluid accumulation in your abdomen. Loss of body hair. Vomiting blood or black stools from varices. Hepatic encephalopathy, confusion and mental changes. Dupuytren's contracture, curled fingers, easy bruising and bleeding. If you're seeing any combination of these signs, don't wait. Get checked. A simple blood test can tell you if your liver is in trouble, and catching it early makes all the difference between a manageable condition and a life-threatening one. Your liver doesn't ask for much. Don't overload it with alcohol. Maintain a healthy weight. Control your blood sugar if you have diabetes. Avoid unnecessary medications and supplements that can damage the liver. Get vaccinated for hepatitis A and B. Those simple steps prevent most liver disease. But if the damage is already done, if you're seeing these signs, there's still hope. Treatment exists. The liver can heal. You just have to take the first step and get evaluated. Thanks for watching. If you found this helpful, subscribe for more medical content that actually makes sense, and check with your doctor if you have concerns. I'm a doctor, but I'm not your doctor, and nothing here replaces proper medical evaluation.